Disease overview. Signs and symptoms. Ctnnb1 syndrome is a collection of signs and symptoms that can vary between affected individuals. It is important to note that every individual is unique and how the disorder affects one person can be different from how it affects another. Neurologic features are present in most individuals affected by Ctnnb1 syndrome. Global developmental delays can affect intellectual development ranging from mild to severe and motor functions including muscle coordination to complete tasks like writing and walking. Many individuals affected by Ctnnb1 syndrome have altered muscle tone. Later in childhood, most children experience abnormally high muscle tone, hypertonia, in the arms and legs, which causes prolonged muscle contractions and muscle tightness, spasticity, and can lead to difficulties with speech and movement like walking and stability. Causes. Ctnnb1 syndrome is caused by changes, pathogenic variants or mutations, in the Ctnnb1 gene. Genes provide instructions for creating, encoding, proteins that play a critical role in many functions of the body. Affected populations. Ctnnb1 syndrome is believed to affect females and males in equal numbers. According to Ctnnb1 Connect and Cure, as of March 2023, there are 300 individuals around the world known to have Ctnnb1 syndrome. Disorders with similar symptoms. Hereditary spastic paraplegias, HSP, are a large group of inherited neurologic disorders that share motor and movement clinical features, like difficulty walking due to muscle tightness, spasticity, in the legs. For more information on this disorder, choose hereditary spastic paraplegia as your search term in the rare disease database. Several intellectual disability disorders can have large overlaps in clinical features with Ctnnb1 syndrome. In some patients, a detailed family history, molecular genetic testing or extensive clinical testing may help differentiate these disorders from Ctnnb1 syndrome. KIF1A-related disorders are a group of neurological disorders with a wide spectrum of clinical features ranging from mild to life-threatening. In some patients, a detailed family history, molecular genetic testing or extensive clinical testing may help differentiate these disorders from Ctnnb1 syndrome. Diagnosis. A diagnosis of Ctnnb1 syndrome is based on characteristic clinical features, a detailed patient and family history, a thorough clinical evaluation and a variety of specialized tests. No formal clinical diagnostic criteria have been established for Ctnnb1 syndrome. Clinical testing and workup. Treatment. The treatment of Ctnnb syndrome is directed toward the specific clinical features that are present. Regular monitoring by healthcare professionals can track symptoms as they change or develop over time, and treatments can be appropriately adjusted to best support current needs. Healthcare professionals that may be part of the care team can include pediatricians and physicians who specialize in diagnosing and treating developmental neurological disorders. Neurologists. Disorders of the eyes. Ophthalmologists. Digestive system. Gastroenterologists. Musculoskeletal system. Orthopedist. And heart. Cardiologists. Additionally, rehabilitation therapists. Physical, occupational and speech therapists, psychiatrists and other healthcare professionals may be needed to plan treatments and administer therapies. Feeding and swallowing issues should be evaluated regularly at clinic visits and appropriately addressed by rehabilitation therapists. In some patients, a nasogastric tube, NG tube, or gastrostomy tube, G tube, to deliver food directly to the stomach may be appropriate. Thank you for watching. Please subscribe for more videos. Your like, comment, and share always motivate us.